Okay, so let's just talk about procedures here, and then we'll go through a couple examples for coding. With procedures, we are going to remember, now we're in the obstetrics section, the body system here is always going to be pregnancy. Okay, we have three values used for body part. We have conception, retained, ectopic. Okay, procedures here, we have abortion, we have delivery. So let's go. A lot of times we're looking at the root operation extraction. This is used for C-sections, vaginal deliveries with forceps, vacuum, internal version. We also have therapeutic D&C performed in other postpartum. Okay, so here we have just procedures assisting delivery. This is a routine assisted delivery. So we have our first character 1, body character 0 for body system, root operation delivery, products of conception, 0, external, none. Procedures assisting delivery, here we have possibly drainage, which would be amniotic fluid. So let's go ahead. We have forceps and vacuum. One thing, we have low forceps, mid, high, and that's going to make a difference on the 7th character. Episiotomy. One thing to remember with an episiotomy, this still, if I have a delivery, episiotomy is normal. So if a patient does have an episiotomy, I consider this a normal delivery. Okay, cesarean delivery. Contraceptive management, we have Z codes here. One thing I want to make note of, if a patient is admitted for just sterilization, it's going to be Z30.2. Okay, if they're in there, they had a C-section, and at that point they decide, hey, I want to get my tubes tied, Z30.2 is going to come further down the line in your diagnoses. Okay, so we have procreative management, genetic testing. Again, you can just read through this. So let's go ahead and run through a problem, because some of these can be quite difficult. All right, so what I'm going to do, I am going to run through, let's go through number 3. I'm in exercise 23.4. So let me pull up my code book. Okay. With this too, a lot of times, okay, I'm looking at number 3. We have an intrauterine pregnancy, 39 weeks. They delivered, and we have occipital anterior single lie-borne primary uterine inertia. Okay, so with this, 39 weeks still makes it normal. Okay, but what we're looking at here is the way they were delivered, and they have an issue. They have the primary uterine inertia. Okay, so a couple of different things here. When looking up codes, you can go to pregnancy, delivery, or just different ways to find codes. So a lot of times, let's just go with pregnancy here for this one. And I'm going to go with, okay, it's not inertia. Okay, so I went with inertia, uterine, okay, so we have uterus, and during phase of labor, okay, and we know we're 39 weeks, so we're going to go with 062.0. That's going to be my principal diagnosis, okay? And what else do we have going on here? Remember I told you we have pregnancy, weeks of gestation. We have 39 weeks. So I'm also going to code Z3A.39, 39 weeks. What's the other thing? We have a lie-born baby. So outcome of delivery. Again, you find these the same way in your book as I'm finding them now. We have a single, okay, and lie-born. So I'm going to have Z37.0. So just 3 codes for that one. All right. With this, when I go towards the back, we get into a little more difficult ones here. If I'm looking at 23.8, let's go ahead and look at number 1. Okay, we're going to code that and then we're going to wrap this up. I have gestational diabetes treated with both diet and oral anti-diabetic medication. I'm 40 weeks of gestation. Spontaneous delivery of a living female infant. Okay, I cannot use my 080 code because this is not normal because I have gestational diabetes. So that's probably the main reason what I'm going to code. So let's go ahead and go and type in, look in your book. Okay, I have gestational. All right. Roll down here. And it says both diet and oral anti-diabetic medication. Okay, so that's important. We need to make sure we get into that right area there. So I'm looking at 024, 425 right here, oral drug controlled. That is going to be my principal diagnosis. Okay, because really everything else, spontaneous delivery, everything else went great. Okay, then I'm going to have my 2 Z codes. I'm not going to look those up because we did that. So weeks pregnant, 40 weeks, so that should be Z37.0. We have outcome of delivery, living female. Take that back. That's Z37.0. My weeks pregnant is going to be Z3A.40. The next thing here that I want to go ahead and code is the manually assisted labor. So when you are in your PCS book, or delivery, let's go into delivery, okay? And this is a spontaneous, manually assisted. And right there's my code. This is super easy. So when you even look it up in your alpha, you're going to come up with 10E0XZZ. Okay. We also had an episiotomy repair, so we do need to code that procedure. Okay, so here we have episiotomy. I'm going to go with a female. All right, and it just codes it right out for you again. Okay, so just a couple hints here. Number 4, when looking at number 4, I'm not going to code it out for you, but I'm going to give you a few hints. We have an obstructive labor, so that's going to probably be our principal diagnosis. Okay, another thing is you're going to code the presentation. So pregnancy presentation, delivery, complication presentation, whatever route you want to go to. You're also going to code the preeclampsia, outcome of delivery, the weeks, and then my classic high cesarean delivery. So again, you got to pick apart each problem that you are coding. I hope this helps. If you have any questions, let me know.